Abuse and poverty during lockdown has led to more babies being abandoned. This is according to children's organisation, The Door of Hope, who's done a survey of 17 baby homes. According to that survey, of the 74 babies received during lockdown, 30 were abandoned. To discuss this, we are joined by Nadene Grabham from the Door of Hope Children's Mission. Nadene, thank you so much for joining us this morning. Tell us more about the survey that you've conducted. You have said before that the occurrence of abandoned babies is in itself a pandemic. But these numbers must be quite worrying for you and others who work in this sector.
Yes, it definitely is a problem, and I think it has gotten worse since lockdown started. Just the survey that I did with 17 homes, they actually had 155 referrals of organized child protection organizations seeking placement for 155 children. 74 of these children were taken in, of which actually 35 were abandoned. The reason why the balance couldn't be taken in by these 17 homes is because they were filled to capacity. So we don't know where these children were placed, but it's still 155 children in 3 months that have needed placement. The sad state is, though, that in articles in the media, newspaper, word of mouth from security companies and the community, since the end of April, 29 babies were found abandoned in unsafe places, and only 6 of these babies were found alive.
Nadene, let's talk about these circumstances that you normally find those babies that you take in. A Door of Hope babies normally come from hospitals, child protection agencies and the police. And of course, you've got the baby box where mothers who feel they cannot no longer care for their babies are encouraged to leave their babies in a safe environment. And now you talk of the statistic around actual abandonment. Is that the one that we should be particularly concerned about?
I think so. You know, the stats, informal stats that were done a couple of years ago showed that around 10,000 babies are abandoned annually in South Africa, but only 1 out of every 3 babies actually survive abandonment. And this could be more. I'm pretty sure that there are babies that are never found, where they are maybe thrown in latrines or in rubbish dumps, and obviously with natural elements or even dogs that roam these rubbish dumps. I don't think we even have an idea of actually how many babies are abandoned every year.
Let's talk a bit about the impact of COVID-19 and the pandemic. We know that there are so many families that are under pressure financially, so many individuals even more so. What are you hearing from those in your sector? Some of the reasoning that you are hearing from parents, from mothers who are giving up their babies during this time?
So I think the reasons for either relinquishing their babies or abandoning their babies haven't really changed. I just think it has increased. The main reasons is always poverty, unemployment. This pregnant mommy might not have support from her family, and more often than not, when we ask the mothers why do you want to give your baby up for adoption, is because the mother of the baby has actually been abandoned by the father of the baby. As soon as she informs the father that she's pregnant, he leaves her. Rape is also a big reason for child abandonment, and drugs and prostitution and illegal abortions.
What kind of pressure has the pandemic and the threat of COVID-19 put on the staff of these baby homes?
Yeah, obviously, because everybody's full to capacity. I think that, you know, staff are working hard already looking after babies, especially when they survived attempted abortions. They're born prematurely, so you have to keep an eye on them 24/7 because their lungs haven't fully developed. You have to concentrate on obviously your hygiene procedures and your concerns using public transport or being in public picking up the virus. But we've got good health and safety protocols in place at our baby home, and so far everything's working out quite well, but it has been quite a stressful period for us.
What is the relationship like between organizations such as yourself and the 17 other baby homes that you worked with in the survey that you conducted during lockdown? What's the relationship like between you and the authorities, social workers, and the government entities who work in this space? Is there enough support there?
Not always. I think some homes do feel that they've been forgotten during this pandemic. Insofar as some areas of the Department of Social Development have been closed, meaning that adoptions and reunifications have been put on hold, and that's why homes are full to capacity. Because we've got children that before lockdown were matched with families or were ready to be reunited with families, but that was put on hold. So these children are taking up spaces for babies that need it. These children should really be with their families, but they're still stuck in homes because necessary paperwork is not being issued, and that's very frustrating. And I know of some organizations, their registration expired at the end of March, and because of lockdown, even though the documentation for new registration has been handed in, some organizations have not received their registration documents, which makes it another challenge. So it's been tough. I must say, our contact or person that we work with at the Department of Social Development has been very helpful. But she's also commented that her hands are tied. The final call doesn't sit with her, and we've heard that some of these departments are only going to be opening in level 1. So who knows how long that is still going to take, and it has been frustrating, yes.
That certainly is concerning. Before I let you go, you're talking about so many homes being at full capacity, your staff trying to ensure the health and safety of themselves as well as the children and babies you're looking after. If people are watching right now and they want to help in some way, shape or form, what do you suggest that they do?
Yes, donations have dropped because of lockdown. Companies are facing their own challenges. So wherever possible, if anybody is willing and able, is to assist us with baby items like nappies and formula. We're sitting with 73 babies in our care. So that's quite an expensive exercise. So help from the public in that sense would be very, very welcome.
Well, we can only wish you and your staff and other baby homes doing similar work everything of the best during this difficult time. Nadene Grabham is from the Door of Hope Children's Mission. Some really concerning issues brought up there by Nadene, including the fact that the paperwork around the adoption of these babies have also now been caught up in amongst the many things that have been impacted by the pandemic. And that certainly is also an issue to raise some serious concern.